masterclass. Whether you're a pharmacy student rigorously studying for your exams or just someone who wants to understand exactly what is happening with these prescriptions, this explainer is designed to be your ultimate study guide. We're going to take the complex, chaotic world of BP drugs and make it entirely accessible. Here is our roadmap for today. First, the BP medicine mystery. Second, the 5 major drug classes. Third, beyond just lowering BP. Fourth, beware of side effects. And finally, overcoming those side effects. Let's get to it. All right, Section 1, the BP medicine mystery. Why are there just so many of these drugs? Moving right along to Section 2, the 5 major drug classes. It is time to categorize the chaos. You know, the entire landscape of these medications can actually be chopped down into just 5 equal groups. You really don't need to memorize 1,000 different names right now. You just need to understand these 5 families: ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics. Literally, by just locking these 5 categories into your mind, you've already conquered the absolute hardest part of this. Let's look at each one. First up, we've got ACE inhibitors. Now, if you're taking notes for your GPAD or NIPER exams, you absolutely need an anchor example for each group. For ACE inhibitors, that anchor is enalapril. Whenever you hear enalapril, boom, think ACE inhibitor. Closely related to those in cardiovascular treatment, we have the ARBs. Your primary go-to example to commit to memory here is losartan. It's the absolute classic representative of the ARB family. Next, beta blockers. These are incredibly common. If you're ever asked for a quintessential beta blocker in a pharmacy viva, atenolol is exactly the answer you want to confidently drop. Our fourth category brings us to calcium channel blockers, which, as the name implies, target the movement of calcium in your heart and blood vessels. The big anchor example to know here is amlodipine. It's super widely prescribed and an absolute must-know for anyone studying this stuff. Finally, we round out our 5 families with diuretics. A lot of people just casually call these water pills. The standard bearer you really got to memorize for this group is hydrochlorothiazide. Okay, Section 3, beyond just lowering BP. Because, believe it or not, these drugs do a whole lot more than just tweak your numbers. These medications are vital because they aren't just a simple numbers game. Sure, they control high blood pressure, but they are heavily relied upon to protect the heart right after a heart attack. They help manage heart failure, and this is huge. They protect the kidneys in diabetic patients. So really, we're talking about ultimate multifunctional protective tools for your body's most vital organs. Which brings us to Section 4, beware of side effects. Let's talk about dealing with those pesky unintended reactions. Now, if you are a medical or a pharmacy student, I highly recommend you literally screenshot this right now. Let's break it down. ACE inhibitors are pretty notorious for causing a persistent dry cough. Beta blockers, they can lead to a slow heart rate and just general fatigue. Calcium channel blockers frequently cause swollen legs. And because diuretics are constantly shedding excess fluid, you can expect frequent urination. Definitely commit this to memory. It's completely essential for exams and real-world patient care. And finally, Section 5, overcoming side effects, because there are absolutely medical solutions to all of this. Let's circle back to that annoying ACE inhibitor dry cough. If a patient gets stuck with this, the fix is actually super simple. A doctor can just switch them over to an ARB. Since they work a bit differently, the ARB controls the blood pressure without triggering that frustrating cough. Problem solved. What about those swollen legs from calcium channel blockers? Look, this isn't necessarily a reason to panic or just toss the pills in the trash. Very often, a tiny dose adjustment by the physician solves the problem entirely. That way, the patient gets to keep all the amazing benefits of the medication without the uncomfortable swelling. And diuretics? We know they cause frequent urination, and the logical consequence of that is dehydration, right? Well, the actionable key here isn't necessarily changing the drug, it's tweaking your daily habits. The solution is simply to maintain a proper water balance. Staying hydrated completely counteracts the dehydration risk while still allowing the diuretic to do its magic on your blood pressure. But listen to me, there's one absolute non-negotiable rule that rises above all of this. Our medicines kabhi khud se band mat karna. Seriously, never ever stop taking your medicines on your own. Whether you've got a dry cough, swelling, or fatigue, you must never abruptly quit a prescribed blood pressure medication. All those switches and dose tweaks we just talked about, they have to be made by a qualified doctor. Managing these meds is a delicate science, and tinkering with it on your own is like playing with fire. It's incredibly dangerous. So, to all the focused learners tuning in, this entire structured breakdown was tailor-made for you. The classes, the broader uses, that side effect matrix, and the clinical solutions, this is your ultimate study guide. Make sure you keep this info super fresh for your upcoming pharmacy vivas, your GPAT, and your NIPPER exams. You've got the whole picture brilliantly organized in your brain right now.